Hello, Dr. David McFadden from the Dental Implant Center in Dallas, Texas. Today we're going to show you a live all-on-4 surgery. For years and through dozens of my videos, I've been telling you, and even going as far as doing graphic videos, to show you how much bone is removed in the all-on-4 procedure. Thanks to a few clinicians that were willing to put this out there on YouTube, today I can actually show you, and you can see with your own eyes, how much bone removal is involved in the all-on-4 procedure. So let's review. I've showed you these diagrammatic models in the past. This is typically how much bone volume is in a natural mouth. So I tell all of you in my videos, if you have some or all of your teeth, and that means you have most or all of your bone, this is you. Your teeth may be decayed, or you may have other problems or fractured that you need to have a full mouth or a full arch of implants done. But this progression shows you from where you may be today or where you were when you were 20 years old. When you take the teeth out and you don't place any implants, bone is lost very quickly. This could take you from here to here 5 to 10 years. And from here to here, another 5 to 10 years. And down to here, this is a case that's almost untreatable. But let me remind you that the all-on-4 procedure that was developed several different times over the last few decades, but the one that we talk about today was developed for patients who were already down here. But it's morphed into this unethical, egregious, common practice where you take people that have all their bone and within an hour you take them down to a volume of bone that represents 5 to 10 years of loss after the teeth were extracted. And the same is true on the lower. We have a huge, most of us have much larger lower jaws, which is called the mandible, much more bone than you would ever imagine. But here's that person, their teeth are removed and they're wearing dentures, they're down to this amount of bone in 5 to 10, sometimes 15 years. And the protocol was actually developed for this patient. All-on-4 was designed for people who were already missing their teeth, wearing dentures for decades, and had massive bone resorption through the natural process. So I would ask you, why would you let an implant doctor take you from all this bone to this amount of bone, typically in 1 hour? They're aging you by 15 years in 1 hour. So they take away that bone to create this flat platform that they talk about. And no reverence, no concern for the patient or the bone at all. It's just literally they're turning every patient that comes in into the same person for their own convenience and their own profits. Again, I'll repeat, this is bold. I know these are bold statements. All-on-4 was designed for this person. All-on-4 was designed for this person. It was never designed for the people like you, 90% of you, that have some or all of your teeth and most or all of your bone. So today, thanks to a few bold clinicians who are willing to put these videos of the bone reduction or the whole process on YouTube, for years I couldn't find these videos because I think in a way that everybody that does all-on-4 knows that the bone removal is the Achilles heel of the treatment. They would not do this in their own mouth, and they would not do this in the mouth of their loved ones. And if they do, I question their moral fabric. But they don't want to show the bone removal. And today we actually have some videos to show you. So again, could be a very good clinician doing the wrong procedure for 90% of you. So I found this video recently, and you may not believe me, but everything above this plastic guide is going to be removed. And it's going to be suctioned into the suction system, which ends up in the sewer system. There's a little tiny bit of bone that some of these practitioners talk about saving to graft in the future. And it's funny that most of the videos they never remember they said that at the beginning, and they don't use the bone that they harvested in the beginning anyway. even so, it's about 5% of the total volume of bone that they're removing. So you'll see a better picture of this. We'll insert these pictures as we go. This poor patient, they had that amount of bone removed down to the level of the guide. So it's massive and unnecessary. I would say it's severely invasive and completely non-reversible. So imagine that you were in some other doctor's office. Let's say, I know that in hip replacement surgery, they sometimes have to take away part of the femur down to where the bone is no longer necrotic. And that's fine. If you've got dead bone, that's fine to remove it. But this is your own living, precious bone that's being cut away, suctioned down into the sewer system. We're going to show you the surgical part of the video next, and we'll speed it up but so that you'll get the point about how much bone is being removed. And I wanted to comment on, a lot of you are, the reason you believe in all-on-4 is because you can't imagine that if it was a bad procedure, how all these corporate implant centers and all these private practices could get away with doing it every day. And the thing is, there's really no oversight in dentistry. We can basically do whatever we want, and with our dental license even, we don't even have to be specialists to do almost every procedure in dentistry. But back to the question for you is, like, how do they get away with it if it's such a bad procedure? If McFadden says it's such a bad procedure, how do they keep getting away with it? Mainly it's oversight. But there's a second, darker side to why they get away with it. Patients don't know what to expect. So I addressed this in my LIPS-RETRACTED video that we'll link below as well, that you'll never see a before and after on an all-on-4 case with a lips retracted. They don't want you to see all the bone they've taken away, and they don't want you to see the pink material that replaces all the bone they've taken away. Please tell me if you find one. I'd love to have you comment below about finding a lips retracted all-on-4 final outcome. The darker side of why they get away with it is the disclosure of the massive, invasive, non-reversible bone removal is either completely omitted or it is toned down so much that they use a tactic. It's like smoke and mirrors. I actually have had the opportunity to review a lot of all-on-4 cases. I provide expert witness testimony for some people here in Dallas, and I've reviewed a lot of these cases, so I get to see clinical notes, surgical notes, and lab prescriptions. So many of the places that perform all-on-4 don't even mention the bone removal, verbally or in the consent form. Those that do tone it way down, like, well, we're going to have to smooth your bone out a little bit, or we're going to have to take some of the peak of your bone down, and it's very dumbed down about what they're going to do. If you don't believe me and you're not willing to do your own research, we're going to link one of our patient testimonials, a Google review for you. This gentleman stumbled upon my videos about the bone removal, and instead of taking my word for it or ignoring my warnings, he went back to the all-on-4 centers and he said, I want you to tell me exactly how many millimeters of bone you're going to remove. And once he presented the question like that, this particular doctor was honest. He said, well, yeah, in order to do an all-on-4 for you, we have to remove 12 millimeters of bone, I think is what the patient says in his testimonial. So that patient actually pushed the doctor to get him to commit to the amount of bone removal. If you don't do that, you're never going to know how much they're going to remove. And even if you try, I promise you that the vast majority of all-on-4 doctors are not going to tell the truth. So thankfully, not only do we have this gentleman's video, we have several other that we'll link below. So you can watch the bone removal yourself and decide for yourself whether that's appropriate for you or not. But I'm here to tell you there's a better way. And I probably have 25 videos on the better way. And it's no bone removal, implant bridges, also called FP1s. So we'll link those videos for you here as well.